Welcome to Knowledge Park. Your body has its own electrical grid. It powers every beat of your heart, every thought, and every movement. Your heart, brain, and muscles are the main power stations. They communicate using tiny electrical signals, but sometimes these signals can have problems. This can lead to health issues. Doctors use special tests to check your body's wiring safely. These tests read the electrical signals without any surgery. In this video, we'll explore 3 key tests. The electrocardiogram checks your heart. The electroencephalogram looks at your brain. And the electromyography tests your muscles and nerves. We'll explain what they are, why they're done, and what to expect. An electrocardiogram, or electrocardiogram, is a simple, painless test that records the heart's electrical activity using electrodes placed on the chest, arms, and legs. The heart's natural pacemaker, the SA node, creates an electrical signal that spreads through the heart. The electrocardiogram shows this signal as a waveform. A normal electrocardiogram shows 3 main components. The P wave represents atrial depolarization. The QRS complex shows ventricular contraction. And the T wave reflects ventricular recovery. Think of it like the rhythm of a song or a roadmap of the heartbeat. ECGs help diagnose conditions like arrhythmias, such as atrial fibrillation, heart attacks, where blocked blood flow changes the ST segment, electrolyte imbalances, and an enlarged heart, limitations of electrocardiogram. A normal electrocardiogram does not rule out heart disease. It detects electrical problems, not structural issues. Early heart attacks may appear normal. Doctors may need echocardiogram, stress testing, or blood tests for confirmation. Electrocardiogram safety notes. The test is completely safe and non-invasive. Avoid placing electrodes over open wounds, burns, or severe skin irritation. ECGs are safe with pacemakers and implants. Special types of electrocardiogram. Stress electrocardiogram, also called treadmill test, is done during exercise. A Holter monitor records continuously for 24 to 48 hours. An event recorder is used for infrequent symptoms. Who should get an electrocardiogram? People with chest pain, palpitations, or shortness of breath, fainting or dizziness, or those with high blood pressure, diabetes, or heart disease risk. An electroencephalogram, or electroencephalogram, records electrical signals produced by brain cells. These signals form patterns called brain waves that can be detected from electrodes placed on the scalp using the 10 to 20 system. Before the test, wash your hair. Avoid gels. Avoid caffeine. You may be asked to sleep less than usual. During the test, you simply relax. Sometimes breathing exercises are used. Sometimes flashing lights are used. Electroencephalogram, duration and results. A routine. Electroencephalogram lasts 20 to 40 minutes. Sleep-deprived or ambulatory EEGs can run 6 to 72 hours. Results are typically available in 1 to 3 days. Different brain waves reflect different states. Delta waves appear in deep sleep. Theta during drowsiness. Alpha waves show relaxation with eyes closed. And beta waves occur during active thinking. EEGs help diagnose epilepsy by detecting spike and wave patterns during seizures. They are also used for sleep disorders, brain inflammation, coma evaluation, determining brain death when no electrical activity is detected. Limitations of electroencephalogram. A normal electroencephalogram does not exclude epilepsy. Abnormal patterns may appear only during a seizure. Movement, blinking, and chewing can distort readings. Sometimes repeat or long-term monitoring is required. Special types of electroencephalogram. Video electroencephalogram monitoring for epilepsy diagnosis. Activation procedures such as hyperventilation and photic stimulation. and invasive electroencephalogram with depth electrodes for surgery planning. Who should get an electroencephalogram? People with seizures or unexplained blackout, sleep disorders, confusion episodes, or for coma monitoring in intensive care. Next, if you're experiencing unexplained symptoms like tingling, numbness, muscle weakness, or cramping, your clinician may suspect an issue with your peripheral nervous system. To investigate further, they may order 2 key diagnostic tests: an electromyography or electromyography and nerve conduction studies. These 2 tests are almost always performed together in a single session because they provide complementary information about the health of your nerves and the muscles they control. The nerve conduction study, or nerve conduction studies, uses small surface electrodes to deliver a mild electrical pulse. This part of the test measures how fast and how strong those electrical signals travel along a specific nerve path. The electromyography then assesses the health of the muscles themselves. It measures electrical activity from within the muscle using a very fine needle electrode, both when the muscle is at rest and during a gentle contraction. Before an electromyography, inform your doctor if you take blood thinners, have a bleeding disorder, or an implanted device like a pacemaker. Certain precautions may be needed for your safety. Together, these tests help your doctor pinpoint the exact location of a problem, whether it's in a nerve, in a muscle, or at the critical junction between them, which is essential for guiding a precise diagnosis and effective treatment. For nerve conduction studies, surface electrodes deliver small electrical pulses. You may feel brief tingling. This test helps diagnose conditions like carpal tunnel syndrome, diabetic neuropathy, and Guillain-Barré syndrome. It takes about 20 to 40 minutes and has no lasting discomfort. Normal nerve conduction speed in adults is typically around 50 to 60 meters per second, but it varies with age, temperature, and medical conditions. Electromyography and nerve conduction studies. Safety notes. Avoid electromyography in severe bleeding disorders, in patients on high-dose blood thinners without precautions, or with skin infection at the needle site. Nerve conduction studies is safe even with pacemakers, though settings may need adjustment. During electromyography, a fine needle is inserted into a muscle to record its electrical activity on the monitor. The doctor records activity while the muscle is at rest and while contracting, revealing how well nerves communicate with muscle fibers. You may feel brief discomfort or mild soreness afterward. Electromyography and nerve conduction studies duration and results. Together, they usually take 30 to 90 minutes. Mild soreness for 24 to 48 hours is normal. Your clinician typically shares results at your follow-up. Electromyography helps diagnose muscle diseases, pinched nerves, and motor neuron disorders like amyotrophic lateral sclerosis. It guides treatment by pinpointing whether the problem is in the nerve or the muscle. Limitations of electromyography and nerve conduction studies. They cannot diagnose pain without other findings. Testing too early after injury, within the first 1 to 2 weeks, may appear normal. These tests are not useful for brain or spinal cord conditions. Who should get electromyography or nerve conduction studies? People with tingling or numbness, muscle weakness, suspected neuropathy, such as in diabetes, carpal tunnel syndrome, or radiculopathy from a pinched nerve. Reading results. In nerve conduction studies, slow signal speed suggests damaged insulation. Reduced strength may mean nerve fiber loss. In electromyography, abnormal spontaneous activity, altered motor unit patterns point to muscle disease or nerve disease. Here's a quick comparison. Electrocardiogram measures the heart. Electroencephalogram measures the brain. Electromyography measures muscles. Nerve conduction studies measures nerves. Electrocardiogram takes minutes. Electroencephalogram around an hour. Electromyography and nerve conduction studies up to 90 minutes. If your child needs one of these tests, you might feel worried. But we take special care to make the experience as easy as possible for kids. First, a parent can almost always stay in the room for support. Bringing a favorite comfort item helps a lot. Think a special blanket, a stuffed animal, or a tablet with their favorite show. We also use simple words to explain what's happening. For an electrocardiogram or electroencephalogram, we might say, "We're putting some special stickers on to listen to your heart," or "This silly hat helps us see your brain waves." For nerve studies, we explain the little tingles they might feel. And for the muscle test, we are honest that it feels like a small, quick pinch. Numbing cream can be used to help with this. A few quick tips for a smooth visit. Dress your child in a loose, two-piece outfit. Pack snacks and drinks for before or after the test. And let the team know about any sensory needs so we can adjust lights or sounds. With a little preparation and teamwork, most children do wonderfully, and you'll be right there to support them. Sometimes, tests pick up false signals called artifacts. They can look like problems, but they're just glitches. Let's look at the most common ones and how to fix them. For an electrocardiogram, a wandering baseline can happen if an electrode is loose. The fix is simple. We clean the skin and press the electrodes on firmly. Electrical noise from other devices can also interfere with the signal. We fix this by checking the cables and moving them away from power cords. During an electroencephalogram, blinking or muscle tension can create noise. We'll ask you to relax your jaw and rest your eyes to get a clear signal. For electromyography and nerve conduction studies tests, a cold arm or leg can make nerves seem slower than they are. We make sure your limb is warm before starting the test. Fixing these small issues helps ensure your results are accurate. It prevents confusion and the need for repeat tests. Up next, we'll cover when to seek routine versus urgent care for your symptoms. Evoked potentials test how fast signals travel in your nerves and brain. We also check F waves and the H reflex. Visual evoked potentials use a checkerboard on a screen. You simply look at it. Tiny stickers on your scalp record the response. Somatosensory evoked potentials use gentle taps or mild pulses at the wrist or ankle, and we track how the signal moves up to the brain. Brainstem auditory evoked potentials use clicking sounds in headphones to measure how your hearing nerve responds. These tests help check the optic nerve, spinal cord, and the hearing nerve. Useful in conditions like optic neuritis, multiple sclerosis, spinal cord injury, and certain hearing issues. What to expect? You sit or lie down. No needles, no shocks. Results help map your nerve pathways clearly. Repetitive nerve stimulation checks the neuromuscular junction. We deliver brief pulse trains and record muscle responses. If responses drop with each pulse, called decrement, it suggests junction problems, often seen in myasthenia gravis. Single-fiber electromyography measures jitter, the tiny timing variability between muscle fibers, highly sensitive for junction disorders. Motor-evoked potentials use transcranial magnetic stimulation to activate the brain's motor areas and record muscle responses, checking pathways from brain to spinal cord. Magnetoencephalography, or MEG, maps brain activity using sensitive magnetic sensors. It is painless and complements electroencephalogram when localizing seizure focus. Electrophysiology study, or EPS, maps your heart's electrical pathways from inside using thin catheters threaded through a vein. Doctors pace the heart and record signals to pinpoint arrhythmia circuits, guiding treatments like ablation, pacemakers, or medicines. EPS is done in a cath lab with local anesthesia and monitoring. Risks are low, and many patients go home the same day. Now, a different tool, an implantable loop recorder. It's a tiny heart monitor placed under the skin of the chest. We place it with local numbing and a small poke. It watches your heart rhythm for months to years and can catch rare problems that short tests miss. Useful for unexplained fainting, strokes with no clear cause, or very occasional palpitations. It's safe and MRI compatible in most cases. You go home the same day. Normal activity starts soon. Thanks for watching. Like, share, subscribe, and hit the bell icon.